Hi, my name's Carrie Page, and I did my practicum in the NICU, and my project is on burnout in the NICU, and this is actually pretty near and dear to my heart because I used to work in the NICU. It was my dream job. It was something I actually wanted to do from the time I was a child. It was my life goal to get my nursing degree and to work in the NICU. I worked there for about a year and a half, and then I decided to leave because I was very burned out and I did not have enough work-life balance in my life, and it was just causing a lot of stress in my personal life. So I decided to leave. So like I said, this is very personal to me. I loved the NICU, but I just had to go because I had no work-life balance. So the NICU that I was in was a level 4 NICU. They have babies that come to them from all over Kentucky. They're very low birth weight. They can be, just needing a little bit of care to needing complete care, from like the high frequency jet ventilator, from being tiny, 360 grams, to having gastroschisis, high drops. Just the level of care that they need can be very intense. They can do bedside surgery. They recently got a new unit a couple of years ago that enabled them to each patient to have individual rooms as opposed to a pod setting. They also have a procedure room to where they can do procedures on the unit versus taking them off the unit. They do have 90 beds. They have about 250 nurses. They are currently under COVID restrictions. Prior to COVID, they were able to have grandparents, parents, siblings come to visit, and now due to COVID, the parents have to stay in their rooms at all times. They have to wear a mask at all times. They're unable to use the community things like the laundry, the kitchenette. They can't use any of that. They have to stay in their rooms. I know with staff, it's putting a lot more stress on them trying to enforce all of that because management isn't really helping them to enforce any of the COVID restrictions and keeping them in their room, and that's a struggle for staff for that. So my learning goal was to assess the level of burnout in the NICU and to also educate the staff on how to prevent, recognize, and also to alleviate burnout, as I know that this is prevalent in a lot of staff in the NICU just because of the way how things are ran. So for my learning objectives, I obtained these by sending out an email through the NICU listserv, just kind of educating staff on what burnout looks like, the causes of burnout, the effects that burnout can have on staff, and kind of how to take steps to make their feelings of burnout a little bit better, how to recognize that in themselves. So the learning objectives were to recall 3 signs of burnout, 3 interventions of burnout, to be able to describe 3 interventions of burnout, and to identify 3 ways to prevent burnout and practice it in their lifestyle. I also created a survey just to kind of gauge what they learned from the email, to see if they were able to recall the information that I had shared with them, and to kind of also gauge their level of experience, and also if they were currently feeling burned out or if they had ever felt burnt out in their career. So in the first comparison of the literature that we saw in class, the article by Dyer, just comparing it to what I saw in the NICU or what I experienced when I worked in the NICU, I do believe that the nurses in the NICU have a higher prevalence of depression and a higher risk of burnout just because they are asked to come on more frequently. They're short-staffed a lot. It is a larger unit, so it is harder to staff when a lot of staff calls off. Burnout can cause a higher staff turnover and reduction in professional effort and a higher intent to leave and loss of productivity. They have a hard time getting nurses to come into work. And I know that their healthcare associated infections are lower. I do believe that the nurses in the NICU have a very high level of pride for what they do, and they do care for their patients a great deal. I know from experience that taking care of babies, and helping them to get better and bonding with their family and those babies, it definitely gives you a certain pride in the job that you have. So I do think that their healthcare associated infections wasn't really relevant to for the NICU, but also the deterioration of interpersonal teamwork. I could see that with, RTs and with providers and physicians, everyone's just kind of burnt out with COVID and having to work more hours, and especially with the baby boom with COVID, you know, they're getting more and more patients and they're having a higher patient volume and fewer nurses to help cover that patient volume and higher acuity of care. So as far as the SurveyMonkey responses, I got 40 responses. They varied in range of experience from 6 months to 32 years. It was interesting to see that, you know, a little over half of them said that they weren't currently feeling burnt out, and the rest said that they were. And then the ones that were feeling burnt out, they had an experience span of 6 months to 10 years. I do know that a lot of the nurses, it's either you're there for a short amount of time or you're there forever. There's really no in between of 5 years or 7 years. It's, you know, you come, you stay, or you come for a couple of years and you leave. Their employee turnover rate is pretty high. I wasn't able to get the specific numbers just because they are so high and there are so many nurses that leave. They go on call, they go to travel. 90% said that 90% of the people that took the survey could correctly identify the signs of burnout. 93% correctly identified burnout prevention, and 90% correctly identified interventions of burnout. So on this slide, I've just included the 2 questions about interventions and prevention and the answers, and you know what people answered and how many people got the answer correct versus how many people got the answers wrong. So this was a feature that I didn't even know about, and I actually kind of found this interesting. This was a trend of responses per hour, and as you can see, it looks like the majority of my survey responses were done by night shift or at night, which is a possibility. I don't know for sure if it was mostly done by night shifters, but it does look like the vast majority of my survey takers worked night shift, and the survey was done at night, which I found very interesting regarding the incidence of burnout and their reporting if they felt burnt out or not. Some things that can cause burnout in the NICU can be feelings of having low control over your job when you come in and, you know, there's 2-to-1s, 3-to-1s, and 1-to-1s. 1-to-1 babies require the most higher level of care. 3-to-1s are just basically feeders and growers. You know, we can be so short-staffed that you can have a 2-to-1 paired with a 1-to-1, or even 2 1-to-1s paired together, which can create a very stressful day or night for the nurse that's coming on to take that assignment. And it can be a very hard day if anything goes wrong. If a baby extubates or keeps desatting or having A's and B's, apnea and Brady events, it can be very hard for that nurse to kind of gauge her schedule and to stay ahead and to have a good day. So that could be a high workload environment, and also having low control over the job. A lot of nurses have primaries. They'll come in, they'll take care of the same baby when they work. Sometimes they can be bumped to have a different assignment if someone needs training and their primary is very interesting and someone needs training on that situation or scenario, they can be bumped, and that can also cause the nurse to be very upset and angry about being bumped. Other things could be low schedule flexibility. The NICU does make their schedule 6 weeks at a time. It's very hard to plan for things in 6 weeks in advance. Things come up, things change, life happens, and if something were to happen, you would have to put out an email to the other staff in the NICU hoping that someone can trade a shift with you and you can take that day or night off. So another issue would be poor leader support, especially during COVID. With all of the COVID restrictions that they do currently have in the NICU, it can be hard for the staff to feel supported when a provider, you know, says that the family doesn't have to adhere to those COVID restrictions, and obviously everybody else does. So that can create a lot of frustration. And then also too, in the NICU, there is a high-ish level of patient mortality. The babies that come in, they're born in the hospital, they don't ever go home, and when they do go home, they don't come back to the NICU if they need to be readmitted to the hospital. They go to PICU. So when a patient passes away in the NICU, they've never left their whole life. They just know the NICU and the staff. So it's a lot of times the staff will get very attached to the patients and their families, and when one passes away, it's very hard on the staff. And it is, especially if it happens in the middle of the shift and there's an admission coming, you're kind of expected to kind of transition from having that mortality into into that admission, which can be very difficult on staff to kind of make that transition. Outcomes of burnout in the NICU can be high staff turnover, also high call-ins, high frequency of call-ins, which can, again, it's kind of a never-ending cycle. You have a lot of call-ins, you have short staff because of the call-ins, and then people get burned out that are there, and then they don't want to work anymore because they're burned out, so then they call in. It's just a never-ending cycle, and the staff morale just takes a tank. So prior to COVID, the NICU had a running club. They still do have it, but obviously with COVID, it's hard to implement any kind of get-togethers for running because of the pandemic. And there haven't been any major like Run the Bluegrass or anything. I know they did several like marathons to kind of help promote just kind of staff bonding and to also help get exercise. I do know too that a lot of the staff in the NICU would go to like burn boot camp. They would work out together, and they would kind of make sure that their workouts were at the same time in the same class so that they could work out together. And then there for a while, the gym was shut down. And a lot of people have kind of had a hard time getting to the gym to work out because of the pandemic. Also, in the NICU, they do like to order food. They like to order out, which can make it hard to get your proper nutrition to help kind of foster a healthy mind. And I did find this interesting that people who work 12-hour shifts find an average of, or get an average of 5.5 hours of sleep per night, with progressively increasing drowsiness for each consecutive shift worked, which can also take a toll on your immune system and cause cognitive impairments in your memory. I do remember that I was not made for a night shift, and whenever I worked 3 night shifts in a row, by the third one I was just dead. And I know that a lot of nurses have reported, I don't remember driving home, I don't know how I got home, especially by that third night shift. It can be very dangerous to drive home. You get home and you don't remember driving home. So just trying to have better sleep habits can also help prevent burnout. But at the same time, with your work-life balance, that can be very hard if you have children, if you're have things you want to accomplish. A lot of the world is awake during the day, and if you work night shift, you also want to be involved in activities and events and just kind of feel like a human and hang out with people, and it's hard to have that balance between sleep and work and having that work-life balance. Just also preventing burnout can be helpful with socialization, having social support. I know they did have a kind of a staff support committee that they did have, that they would bring in like a therapy dog, they would bring in chocolates for staff or donuts, just to kind of help with everything that was happening in the unit. Like I said, the patient mortality, it's not super high, but when it happens, it's pretty devastating and can take a lot of toll on the staff. So having that support was very important to staff, but it's hard with COVID to kind of get that because you can't really bring anybody into the hospital to help. You can't bring dogs into the hospital, therapy dogs into the hospital anymore because of COVID. So COVID's kind of put a damper on all of that. Other interventions of burnout can be taking 15-minute breaks and stepping off the floor to alleviate feeling overwhelmed. Obviously, as a nurse, it's hard to step away, especially when things are intense and crazy, to take a moment for yourself and take a breath. And then also it should start with your leadership. Your nurse managers should look at kind of themselves and kind of promote health and wellness with the staff, and kind of maybe see about any kind of incentives that they can, promote. I know my employer, they do like the Apple Watch thing, whoever gets the most steps can win a prize. So things like that are important to help kind of keep a healthy body, healthy mind, and keep you from feeling overwhelmed and burned out. So I actually found this article very interesting. This was in the class, and it was just about how like Johnson & Johnson and some of the automakers have a buy-in program for their employees, and they actually integrate it into their employee overall performance review, which I thought was very interesting, and that could definitely be something that the healthcare industry could try to implement, because definitely if you have healthy, it starts from the top. If you have healthy employees and employees that want to be there, then everything's going to trickle down. Happy employees, happy nurses equals happy and healthy patients. So barriers to everything that I suggested to helping reduce burnout would be the vacation policy. They do have the blackout dates for the vacation where you can't take a vacation in certain times, which is in the summer. It's based on seniority. It's it's not first come, first serve. It's based on seniority, which makes it hard for staff to get vacation when they want. Their turnover rate is incredibly high, so their staff retention is low. And then the 6-week scheduling, being short-staffed, the patient-family conflicts with just having COVID issues and, staff saying one thing and not having backup from management or providers, which can also go from lack of support from the management, and then the higher acuity of patient mortality, and then also just COVID taking a toll on everything in all aspects. So I do think that my email and survey may have helped staff kind of recognize some symptoms of burnout and kind of take a look at themselves and to see kind of where they are and how they're feeling right now with the pandemic, and just kind of, what to do if they are starting to feel burned out. But I do know that there are certain issues that are higher up than just the nurses that can't be fixed with causing burnout. But I hope that the staff will kind of reflect on themselves and the symptoms of burnout and what they can do to kind of help themselves get through that rut and feel better if they are feeling burnt out.